If there is an area where Sri Lanka has taken great strides as a nation in the post-independence era, it would be our exemplary health indicators, which are us far apart from most neighboring nations. Our universal health coverage extends free health care to all citizens, which has been a national priority for several decades, and an integral partner in this achievement is our national immunization programs. Despite the country undergoing severe economic constraints, first due to the 30-year war that ripped our country of social fabric, placing a massive burden on the country's treasury, and later on due to natural calamities such as the 2004 Indian Ocean tsunami, and then the economic crisis fueled by the COVID-19 pandemic, Sri Lanka continued its immunization program even in the war-torn regions in the north and east. However, a recent phenomenon which is catching on fast among the people threatens to upend many of the hard-won achievements of the medical community over the past several decades. In some of the Western countries, there has been a recent trend where parents refuse to vaccinate their children due to numerous reasons and perceived fears. While opposition to vaccines is as old as the vaccines themselves, there has been a recent surge in the opposition to vaccines in general, specifically against the MMR, measles, mumps, and rubella. Most notably since the rise in prominence of the notorious British ex-physician Andrew Wakefield and his works. This has caused multiple measles outbreaks in the Western countries where the measles virus was previously considered eliminated. Unfortunately, there is an alarming number of parents in Sri Lanka too, where they refuse to vaccinate their children due to reasons ranging from religious convictions to a misconception that vaccination can cause autism in young children. Some of the reasons behind this trend reaching Sri Lanka and gathering momentum could be pinned on the role of the internet in spreading anti-vaccination propaganda, where some fail to recognize the repercussions in terms of public health and safety in not immunizing children against debilitating diseases such as measles and mumps. A communique issued by the Colombo Municipal Council notifying the people of a recent outbreak of measles and urging the parents to vaccinate their children against the disease is an apt example of how refusal to vaccinate children can lead to the spread of diseases thought to have been properly controlled in Sri Lanka. The notice warned that contracting measles could have long-lasting severe side effects in children, leading to hearing loss, loss of vision, pneumonia, and encephalitis. It also urged the parents, if they have children below 15 who had not received the MMR1 and MMR2 vaccines at 9 months and 2 years respectively, to get them immunized immediately at the government clinic. The refusal to vaccinate does not only affect your child, it can also have life-altering repercussions on hundreds of children who cannot be vaccinated due to various medical reasons. An immune-compromised child who cannot be vaccinated can contract a life-threatening disease from a child who had not been vaccinated out of choice. Vaccination is not a personal choice. You are making a decision for your child that could endanger their lives, could have far-reaching health repercussions that would affect their future well-being and threaten the lives of children who do not have the choice of being vaccinated due to medical reasons. Therefore, before you decide to refuse to allow your child to reap the benefits of a time-tested method of disease prevention based on perceived reasons, spare a moment to those children whose lives depend on herd immunity for disease prevention. We reiterate, vaccination is not a personal choice, but a communication responsibility.